Hi, my name is Shelby Sparks, and here is my Liberty University ID, and this is my informative speech. Imagine walking through the mall and all of a sudden somebody collapses, and you have absolutely no idea what to do, and they are turning blue. That feeling of helplessness is one of the worst feelings, and so today I'm here to teach you about hands-only CPR. Hands-only CPR is super important because it has been proven to increase survival rates by the American Red Cross. So the first thing that you do for hands-only CPR is you check the scene. You check the person, you check the scene. Is it safe for you to proceed? The next thing you do is you tap the patient to see, are they awake? Are they responsive? Usually they're not. And then you call for help because you're going to be doing chest compressions for a really long time if you don't call for help. So in order to do accurate chest compressions, you're going to intertwine your fingers like this and make sure you lock out your arms. In Grey's Anatomy and all the other funny medical shows, you see them bending their arms as they do chest compressions, and that is not adequate chest compressions. You also want to make sure that you're doing it to the right rate. A lot of times people will do Baby Shark, I think that's my favorite one, to that beat, because it's the beat of the rate that you should be giving chest compressions. So basically you're going to place the heel of one hand on the center of the chest, so about right here. You're going to place the heel there, and then you're going to place the heel on the other hand on top of it, lacing your fingers together. And make sure you keep those arms straight. You want to push hard, but you don't want to push lightly. The harder the better, because you're going to make sure that blood is really pumping through the body. You also want to push fast. Usually they like about 100 times per minute because normal heart rate is 60 to 100, but if they're unresponsive, you really want to get that perfusion going. The beauty of hands-only CPR is you do not have to give rescue breaths, because if you are in the midst of a person that you don't know, you don't necessarily want to be sharing saliva with someone who could possibly be HIV positive or something. So hands-only CPR has been shown to be just as effective as EMS is arriving. So the number one thing you do with hands-only CPR is you never stop. You continue doing chest compressions until someone comes to help relieve you or they bring the AED machine. AED machines can be found really at any place, parks, they'll have them in little boxes, malls, Target, really anywhere has this little box that says AED. And so as you're giving the chest compressions, somebody is opening up the AED machine, turning it on, and putting the sticky pads on the chest. And then you're going to stop chest compressions for that quick little second so that the AED machine can analyze the rhythm. If it needs to shock, it will say shock, and the number one thing you need to do is stand clear. And you have to make sure that everybody is clear. That is your number one job. So if it says shock, you say clear, and it shocks, and then you go straight back into chest compressions. You keep doing this for really until EMS or someone else, like a doctor, comes and calls it. But you want to constantly do pulse checks to make sure, does this patient have a pulse, and we're just keeping on doing chest compressions. You want to make sure that maybe nothing is blocking the airway that you possibly could remove, but you never want to do a finger sweep. And you just basically want to look for signs of life. Is there breathing? Is there any form of this is working? But the most important thing is the depth and the rate of how fast and how good your compressions are. Studies have shown that the better the compressions, the better the life expectancy and the life or review of compressions is going to occur. And so that is the most important thing. Also, if there are gloves available, use gloves. And you might hear the patient gasp every once in a while. That's not breathing. You actually want breaths that come back, and you want, level of consciousness to be there. So hands-only CPR is super, super, super important because it relieves the helpless feeling in case you're at Black Friday and someone has a heart attack and just drops next to you. You know what to do, and you are equipped. Thank you very much.